system, and no discussion of the immune system would be complete unless we talked a little bit about the gut, because most of your immune system is right on the other side of your gut. And so this week it's all about immune boosting you. And so today I'm going to talk about what can be hidden in your gut that you don't know about, and also how important your gut is and your gut health for so many different reasons, you guys. So immune boosting you, what's hiding in your gut? That's what we all want to know, right? So let's just dive right in. Once again, is this moment helping you? Are you in a good place? Are you moving forward? Are you growing in the way that you want to grow? Are you connecting? Are you challenging yourself? Are you being nourished? We want to keep this in mind as we go through our day, right? That big basic principle of making every moment count, because you just don't know what's going to come in the future. All we have is right this moment. And right this moment, we're going to talk about your gut, right? Who's hiding in there? So we do have potential invaders. We've got a lot of good guys in there. And we have these potential invaders, parasites, bacteria, fungi, viruses, and they can throw off our happy milieu who should be in there like creating vitamins for us and all that kind of stuff. They help us digest our food. They help us actually absorb our vitamins. There's so many good things that those gut bacteria do for us. That's really what we want to focus in on. So what I'd like to do is I'm going to share some slides from a brilliant physician who explains things so well. And this is from Dr. Munkas Yusuf. He is a member of the Hepatitis Working Group. He's a professor in internal medicine, and he made a really cool slide deck that can help us understand why your gut is so very important. So I'm going to go through this, and I'm going to try and give you an overview of the gut microbiota. We're going to talk about who's living in there, why they're living in there, how you can become sick if they are not happy, and just trying to do everything that we can to create a happy, healthy gut for you. Okay, so we're going to talk about quite a bit about your gut microbiome. So the first thing, I just love this. When we think about all of the issues that lead us to feeling good or feeling crummy, right? It's our genetics. It's what happened in utero, because now we know, like in utero, if your mom had somebody in her family die, like a child die, you're increased risk of diabetes, increased risk of obesity. So stress while you're a fetus in utero determines what genes gets turned on and off, right? So profound. So be nice to any pregnant ladies, right? Okay. I remember when I was 7 months pregnant, and my husband and I were sitting outside of a very small airport right there, ready to go. And we were reading Harry Potter, and they shut the door. And we had been there for like 2 hours, and they shut the door. And I was a big pregnant lady, and they're like, oh, and we saw them shut the door, and we're like, hey, wait, we're right here. We just signed in. There's nobody else at all in the waiting room, right? We're the only ones. And they're like, no, you can't get on. Oh, what a stressful event that would have been. I wonder which kid that was. Wonder. So in utero, what happens to you affects your illnesses when you are older, right? Your life experiences, the things that you are exposed to, and then what our habits are. So all of these things are what create our current internal environment. And many triggers can affect whether or not we end up with those diseases of civilization, right? Cancer, heart disease, depression, all those things. And what we're talking about is how can we avoid that, right? And your gut plays a huge role in avoiding pain, obesity, asthma, psoriasis, inflammatory bowel disease, Alzheimer's, depression. Your gut is way important, guys. So let's talk about it. I love this, okay? A short story. One day the body parts were fighting with each other about who was the most important. The brain said, I am the most important. I control everything. The heart said, I'm the most important because I keep the body going. The liver said, I'm the most important because I help in metabolism, excretion, and detoxification. And finally, the gut said, I'm the most important. I digest, absorb, protect, excrete, produce hormones, reabsorb, and everybody laughed at the gut. And the gut got angry. So the gut shut down. And within a few short days, everybody agreed the gut was the most important. So for those of you who ever experienced a gut shutting down, in our family, we've had it happen. My husband's gut, at one day, it decided, oh, I'm just going to shut down. Well, we had to take him to the hospital. It was terrible. Things need to move through, okay? So it's so important that they have known it since forever, right? Hippocrates, all disease begins in the gut. Health is determined by the microbiota in our gut. How did Hippocrates know that so long ago? Well, I think that, let's just understand that there's a lot more of them than there are of you, right? Your microbiome weighs a couple of kilograms, right? That's like 5 pounds, you guys. So the bugs living in you weigh a bunch. There's, 100 trillion microbes in the human intestine, okay? So there's more of them than you. It's a significant part of your body and your body weight. And, what's true is that it's not just in your gut that these guys live. They live all over. They live in your nose. They live in your ears. They live on your skin, in your genitalia. They are all over, not just in your gastrointestinal tract. They're also in the upper respiratory tract too. So they're all over your body. And when we look at the whole gut system, from mouth to your bottom, what we see is there's a pH gradient. So if you recall, a low pH means acid. And in your stomach, the very first place, right, when you swallow, it goes right to your stomach, has an acid pH. And in an acid pH, that's there to protect you, right? That's why you need to have acid, right? If we block acid, we get set up for other problems, such as issues with our microbiome. We should have very little bacteria in an acidic environment. And as the food moves on down through the small intestine, that's the middle part, into the large intestine, the colon, the pH gets more and more alkaline, more and more basic. And then down in that large intestine, there's lots of bacteria happily doing their thing, right? That's good to have them there. We want them there. What we understand is that we can look and see like what the rough breakdown is in people. And why that's important is we understand that there are some that help us and some that don't, right? You guys have heard of food poisoning. Who's had food poisoning? I've totally had food poisoning. Oh my gosh. You almost know it immediately. It just comes on, right? So food poisoning can be caused by the actual bugs in the gut or by the toxins that the bugs make, right? So you guys have a sense of there's bad bugs and good bugs. But did you know there's bugs that there's so many that we can't even know about them all, but there's some specific ones that deeply affect what's happening in you. And they can affect us in many different ways. Now, how do we end up with whatever we end up with? Well, it depends on, how we were born. Did we breastfeed? What are we eating? And I think this is an interesting one. Could it be that eating healthier changes your gut microbiome, and that's why you lose weight? Because that's something we're going to talk about, because there's studies showing that certain kind of bacteria in your gut lead to a thinner body habitus. Do you exercise? What's the inflammation like in your body? And so where do you live? Different people who live in different places, generally they're eating different things. They are going to have alterations in their gut microbiome. Of course, medications make a difference. How old you are makes a difference. So there's a lot of factors go into who's living in you. And as we try and figure out, what has happened, we've looked at people from the time they were born, right, until they got older and started to develop their gut microbiome. Because when a baby's first born, it's sterile, right? There's nothing in there. And usually a baby coming through the birth canal is picking up a significant amount of bacteria, good bacteria from mom, right? So the first challenge there is somebody who's born by C-section did not necessarily get mom's good flora. Now in delivery rooms, sometimes they're actually intentionally inoculating the baby's mouth with some of those vaginal secretions so that they can start to get good gut flora. Then breastfeeding versus bottle feeding, what we're seeing is a big difference in the microbiome of babies. So that as they start to eat solids, that's going to change this even more. So what you eat does determine who's living in you, okay? And this is why it's so important. Like if we start to treat you, we do a SIBO protocol or a leaky gut protocol or with your doctor or whoever, it's going to go back to being the same unless you change what you're eating, right? So it's not like you can go and nuclear bomb, give an antibiotic, kill it all, and it's going to just grow back magically as a good gut microbiome. You actually have to cultivate it, okay? We see when we're looking at kids in Africa, they have more gram-positive organisms, a Western lifestyle, more Firmicutes, more gram-negative organisms. So, that's probably because they're eating different fiber and bacteria enjoy that fiber as food. What we're seeing, though, is over decades, because of these things, increased number of cesarean sections, more antibiotics in babies, a reduction in breastfeeding, an increase in hand washing. Who thought hand washing would be, right, a problem? But too clean is a problem, all right? Widespread use of antibacterial soaps. Your immune system needs to have that stimulation, so it's going to be able to protect you. So it has seen the bacteria, right? We talked about how you want to give your immune system exposure so that it can say, oh, I recognize that's a problem. And the next time it sees the invader, it can get ready for it. So, there is a thing with too clean. And right now, of course, we do want to do hand washing when we're in a pandemic, we want to protect ourselves. But sterilizing everything is not what it's all about, okay? The role of the microbiota in health. How does this affect? Well, this is how you develop your immunity, right? When things go down the gullet, our immune system is going to be exposed to it and going to decide, friend or foe. And that is how we shape our immune system, right? So it's so important. And this is a symbiotic relationship. We're giving them a little house, right? Nice, soft, cozy, warm place to live. And what they're doing is they're providing the vitamins. They're protecting us from the bacteria that make us super sick. They are also increasing our ability to metabolize, okay? Because they digest part of what we swallow. That's part of how we can get gas. When bacteria in us are digesting our food instead of us, that is when we start to have more gas. Interesting, right? You may have heard of your gut lining being very important. This is a busy slide. I hate this for you, sorry. But what we see is that inside the lumen, in the tube going down, that's where the happy bacteria live. And this is also where we can start to regulate our immune system even more. The PAMPs are pathogen-associated molecular patterns, and all these little parts of our immune system are waiting to see if PAMPs show up, then they can send out the alarm and they can create protection for you. So that's what they're doing. All of your immune system is trying to create protection for you by waiting right there on the other side of your immune system. And in order for you to have a healthy immune system, it's important that only the right things that are supposed to come through the gut wall get through, because this helps your T cells to understand what they're supposed to be doing, to get the right instructions, to give the right instructions to everybody else, right? So another busy slide, just talking about how your immune system uses the gut as a springboard for everything that it does to protect you, okay? So it also has that nice barrier effect, right? You got to get through the wall before you get to me. And so here, these are what we call tight junctions. They're not supposed to let stuff through. And when items that are in the lumen start to come through, that's when we begin to have things like autoimmunity, and we can get other issues. We've talked before about the gut-brain axis. The gut and the brain are always talking. The gut is the primary maker of happy chemicals, serotonin. That is coming from your gut. And the whole time there is an open line of communication between these two. So there's just so many different ways in which our gut microbiome affects us. We know that when we are not getting good food, probiotics, fiber, or when we're having, should we take repeated antibiotics, that kind of thing, it affects how they're living in us and how happy they are to be living in us. I'm going to go through something called dysbiosis first. Dysbiosis basically is when your bacteria get unbalanced, right? They start to have more inflammatory components, and they stimulate the body to get inflamed, right? Chronic inflammation in the body, that is the enemy. We do not want chronic inflammation. But what can happen when it starts to get inflamed, we can start to have a leaky gut. And then our wall is when I think of Game of Thrones, the wall, right? The wall gets broken, like when that dragon came at the end. It was so terrible. Oh, the end of Game of Thrones. That was yeah, gosh, don't know what to say about that. Okay, so here we have, the talking about the leaky gut hypothesis. When things that should not get through start to come through, this can create a situation where our body starts to recognize molecules that we shouldn't be recognizing as foreign, okay? They just shouldn't have gotten through in the first place. And this can create things like autoimmunity, problems with your immune system, autoimmune stimulation. So we want to avoid leaky gut as best we can. And this is a long list of different diseases of the gut. I'm not going to go through that right now. I don't think it's all that helpful. Understand that the primary reason that gut's there is to protect you and also to help you absorb. If you're not absorbing well, you're not going to have everything that you need for, building blocks to make stuff, right? And when you have dysbiosis, this can lead to malabsorption, right? You have to have certain vitamins and minerals and nutrients in order to make energy, make new cells, make new membranes. And when we have bacterial overgrowth, like the bad guys overgrowing, and what might lead to that, surgery could lead to having bacterial overgrowth. Everything slows down for a while. Sometimes we'll have problems with acid production. And if you don't have acid, you can't kill off the bugs that you should when you're swallowing food down, right? You might have problems with the movement of the bowel, so it's not moving things through normally. So several different issues can lead to that malabsorption related to bacterial overgrowth. And one very common infection that we see, at least in the hospitals, difficult to get rid of, is C. difficile infection. The gut microbiome, when C. difficile, which is a certain kind of bacteria, overgrows, it gets people super sick, right? And it's so difficult to get rid of. I remember when I was working in the hospital, what we would see is you have to always, it's so contagious. You have to gown and glove if somebody had C. diff, even if you're just going into their room. So that is an example of the imbalance. And we also understand that dysbiosis could potentially be related to colorectal cancer, okay? And this is like a failure of the immune system to clear out abnormal cells, and then they start to grow out of control. So another reason we want to make sure that we are keeping that gut super happy, right? When you are either eating a standard American diet, nitrates, nitrites that can stimulate DNA breakage and damage, carcinogens, all that, that charcoal crisp that you thought tastes so good, it really doesn't, guys. It's a carcinogen. It can lead to imbalance in the microbiome and a disproportionate pro-inflammation, like more inflammation. And we can end up with problems such as colorectal cancer. And nobody wants the cancer. So I want to talk briefly about inflammatory bowel disease because this has been linked to dysbiosis and small intestinal bacterial overgrowth, right? So what's inflammatory bowel disease? Basically, this is a group of inflammatory conditions, autoimmune conditions, where the lining and the layers of the bowel wall are affected. People can have diarrhea, constipation, blood in the stool, abdominal pain, weight loss, all kinds of really troubling effects. And this is about a dysregulation of the immune system in the gut. So all the more reason we are trying to balance the immune system in the gut. And for those of you who have FSM, it is possible that we can help with that using microcurrent, help to reduce the cytokines that cause problems. Now, I want to touch on this because it's so far-reaching. Carrying extra weight is difficult. We don't feel good. And, in days gone by, people would, we would think that, oh, it's just that person ate too much, right? Oh, they're not exercising, they're not eating too much. And people will go to their doctors. Some people would be shamed by the doctors. It's horrible, really, because now those of us who are paying attention understand that our microbiome has a lot to do with whether or not we're carrying extra weight or whether or not our sugar levels are high. So for those of you with diabetes or carrying extra weight, metabolic syndrome, this is so important. So over the past 25 years, we've had this huge surge of people carrying extra weight, more problems with cholesterol, hypertension, diabetes. And when we're looking at the research, what we see is a significant impact that your gut is playing on that, because it affects your ability to make energy, to store energy, and whether or not how high your metabolism is, right? When we look at mice that don't have any germs in their gut, right? So sterile mice, they're protected against obesity, all right? And when we take those little mices and we give them the gut microbiome of a heavy mouse, they become heavy. And we give them the microbiome of a skinny mouse, they become skinny. Interesting, isn't it? Did you guys know that? So research implicates the gut microbiome as critical determinant of our weight, right? And metabolic disorders, right? Because they all go hand in hand. Here's a picture of that. What you see is a different gut microbiome community in the heavy mousey and the skinny mousey. So one day, I would, with 100%, I would predict, right, that we will do fecal transplants to help with weight loss. That'll be a thing, if it's not already a thing. This is just going through the details of fecal transplantation in the mice to see whether or not, let's see what happened. And the reason it's so important to understand this is, number one, wouldn't it be cool if that was available and a way that we could do a fecal microbiota transplantation and help somebody move their weight quickly in the right direction? Okay, wouldn't that be cool? So when we think about how all the areas that are affected when we're carrying that extra weight, our brain is affected, right? Our liver is affected. Adipose tissue makes inflammatory substances. In our muscles, we have issues, and then our endothelium. So lots of different, and you just don't feel as well, I think, when you're carrying that extra weight. And then when people are carrying extra weight for a while, many times we can move into problem like diabetes. So here, in this slide, it's interesting. This over here says fiber on this side, fiber versus fat. And I want to point out that this right here, this is refined carbohydrates, sugar. So this is not, so the issue is not fat. We want to have healthy fats in the diet, okay? The issue here is the donuts and the cupcakes, which is refined carbohydrates and sugar, because the bad guys love that stuff. Those kind of bacteria that are going to create weight, they'd rather eat that, okay? Same thing for other like such as yeast that might live in ours. That's what they want to have. They want to have the cupcake. And I think it's part of the reason that we see many cravings, because what's living in us kind of drives us to eat what it wants. So that is something that you can use as a tool when you're trying to steer yourself towards something that's healthier. Keep talking to your happy gut, to your good microbiome, and say, hey, I'm going to eat for you. I'm going to eat some probiotics. I'm going to eat some fiber. I'm going to avoid the cookie because I want to take care of you, right? So it's just a strategy. The gut microbiota appear to play into cardiovascular disease. They appear to play into lung disease. I know that when I get someone gut better and they have asthma, their asthma gets better because of this crosstalk between the different systems, all right? So I'm going to jump through here, and it's talking about how do you tell when you might have dysbiosis or imbalance, frequent gas, bloating, discomfort. If you're running to the bathroom, cramping, got to go quick, mucus in the feces, certainly if you have blood, something you want to check out with your doctor, right? What if you have brain fog, anxiety, depression? Sometimes that can be because of who's living in your gut. It's not something we really thought about. Maybe you haven't ever realized that that fatigue you feel after a meal, right when your sugar drops low, it might be having something to do with who's living in you. Food sensitivities. Do you have a problem with strong breath or bad breath? That could be an indicator that you have an imbalance. Loose stool, constipation, or both. Did somebody diagnose you with irritable bowel syndrome? Or maybe you've had a lot of antibiotics in the past. Low energy, fatigue, especially when combined with gut stuff, that is worth looking into. Autoimmunity, things like Hashimoto's, thyroiditis, rheumatoid arthritis, psoriasis, multiple sclerosis. Any of those, we want to look at how we can improve the gut to help improve these other seemingly unrelated conditions, right? One very interesting find is that when people's gut gets better, a lot of times allergies get better. A lot of times sinuses get better. So it's worthwhile for us to balance that gut and address any kind of problems that we find. Now, there's different ways you can look at the gut microbiome. And I'm going to tell you that I do not even use stool tests very much anymore. That's because a stool test is a momentary snapshot, right? And if I'm going to be honest with you, what I usually would use a stool test for is to give you encouragement that you're going to do the thing I suggest you should do, right? Because it's more about your symptoms that guide what we're going to do. There are some stool tests that will guide, like pancreatic insufficiency. So there are some that are useful, but generally speaking, if your gut's not happy, our understanding of the gut microbiome is not yet advanced enough for us to have this deep interpretation that lots of physicians claim they're able to do. I have to tell you that, okay? Being fully transparent. That said, if you really want me to check your poop, I will, and we'll get some useful information. But it's just not, we just don't understand it enough at this point to say, hey, this is clearly what's going on here. So a doctor was going to look at the stool test, and they're going to look at you, and they'll do the same thing probably even without that poop test. So that's a little trade secret. And I just, some doctors may disagree with me, but I know when I first started functional medicine, I always got that stool test, always got that stool test. And now I see that I'd rather get it after we've tried a standard gut protocol that helps most people, and then at the end see what's left over. And that would be the way I usually would use a stool test. I'm not going to go into the sequencing. You can do sequencing of the whole gut microbiome. And this is something we talked about, that it was on the horizon. Already you can get a fecal microbiota transplantation for C. difficile infection, because that was shown to help. And this is when you take a little bit of poop from somebody else and you give it to the new person. Now, it's important to realize that it's got to be a very healthy person where the fecal matter comes from. Looking at this is first documented in 4th century China as yellow soup, trying to help support the microbiome. In some countries, maternal feces is, a little bit of poop at the mouth right at the beginning to get things going. And in 2013, the FDA approved being able to do fecal microbiota transplantation for C. difficile with a 92 to 95% success rate. You guys, that's really big. But you definitely want to make sure you know where it's coming from. So this one day is going to be used for a lot of things, right? For weight problems, possibly for things like autism, things that we know there's a link to the gut, where if we could clean up the gut, people do a lot better. Obviously, inflammatory bowel disease, irritable bowel syndrome, chronic constipation. These are all potential indications to help. Now, it's still in its infancy, but all that happens is a carefully screened donor stool is mixed with saline, and then it's either put in capsules, an NG tube, or a fecal enema. And then the idea is that the good bacteria are supposed to multiply and flush out. And right now we're talking about C. difficile because that's the one thing it's definitely approved for, although it's a little difficult to get a gastroenterologist to do this. I had a patient, we were trying to get them to go for it, and finally had to go to, out of the area because they couldn't find anyone locally to do this. So what we understand is that this is just the beginning of understanding the microbiome, and it is a big part of your immunity. I want to touch briefly on these other types of invaders, parasites, and fungi and viruses, because most of all, we've been talking about bacteria, the good, the bad, and the ugly. I think C. difficile is the ugly. Let's talk a little bit about parasites. Here's the fact of it, you guys. There's this idea that in the United States, we don't have parasites. Parasites are exceptionally common, right? And the understanding that parasites are common leads us to going, well, why don't we acknowledge this? Who has a dog? Do you guys give your dog dewormers? Who lets your dog lick you? Okay. Anybody getting a lick in the kisser from a dog? Well, that right there. Hello, parasites. Come on. It's naive to think that we don't have a lot of parasites. And if you have gut issues, it may be worth talking with your naturopath. And I say naturopath here because naturopaths tend to know that parasites are an issue. I'm a medical doctor. I'm an MD, and I'm a naturopath wannabe, so I practice kind of like a naturopath in that I do pay attention to these things like parasites, like fungi, but it's worth looking into, and sometimes doing empiric treatment if it's safe and won't harm you. Treating herbally can be very helpful to people. That you can even DIY that, right? That's something that you can do on your own. DIY parasite treatment if you're having a lot of gut trouble and you've tried stuff and it hasn't gotten better, okay? Now, fungi are another thing. You might have heard about Candida or yeast. When these kind of creatures overgrow in our gut, it can cause a lot of trouble because they make toxins that affect us in many ways. So sometimes people can have significant gut effects, but also have other things like brain fog, anxiety, depression, rashes, just feeling crummy all over, coming from an overgrowth of something like Candida or yeast or fungi in the gut, okay? Viruses, viruses can stick around long term. That's the big problem with them. Right now, it's looking like maybe 1 in 5 people are going to be dealing with something called long COVID. And for that, we really want to focus on getting your gut better. There's a couple other tricks if someone feels like they've got long COVID. But in order so that our immune system stays intact, getting that gut back to healthy is so important. So I think that once you understand this is going to allow you to be able to make a big difference in your long-term health by being able to, either do a gut protocol. A gut protocol it's not rocket science. I'm not even talking about big antibiotics or anything. There are herbals that you can use safely, naturally, hopefully in conjunction with a naturopath or a holistic integrative physician, that are very safe, and that is a reasonable way to go. Now, if you have some of those, if you have C. difficile colitis and it's not going away, you really may want to consider microbiota, a fecal microbiota transplantation, right? Or some of those other inflammatory disorders. It could be worth considering. So this is why we want to treat SIBO, small intestinal bacterial overgrowth, or any of these kind of overgrowths for your long-term health. That was the longest one I've done in a while. Sorry, you guys, that might have been too much. So I hope that you found that helpful, and I hope that you have a really good day and that your gut is way happy. All right, you guys, I'll see you later.